Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, Member Engagement and Communications Manager at GIG Gulf. PCOS, the four letters that make women's hearts just sink, and the most common cause of infertility. We're here today to shed some light on this condition and make it less scary so you know how to manage it. I'm here today with Dr. Ishrat Khan, consultant endocrinologist from King's College Hospital, Dubai. With decades of experience in the UK and UAE, she is committed to delivering personalized and high-quality care to all patients, ensuring that they fully understand their condition and what treatment or self-management they can do and what it will achieve. Thank you so much for joining us today, Dr. Ishrat.
Thanks for inviting me over and giving me the opportunity to speak on a very important topic.
Okay, so let's start by explaining what is PCOS and what the abbreviation is.
So the acronym basically stands for Polycystic Ovarian Syndrome. And when we say syndrome, normally it's the cluster of the symptoms put all together. So what exactly the condition is, it's the metabolic condition with hormonal imbalance, but it also has a reproductive component into it. So it's not a straightforward thing. Previously, we used to think it's just to do with the reproduction, but now it's more of a metabolic disease as well, or condition as well.
Okay, so how do you diagnose PCOS, and what are the most common symptoms?
The diagnosis is mostly clinical, so there is no lab work as such which would, just we do it and give you the diagnosis. It's based on the symptoms. So, and the criteria we follow is Rotterdam criteria. And you need to meet two criteria out of the three. The number one and the most important is irregular periods or no periods. Then some girls present with androgen excess. So that could be excessive hair growth in the area which you wouldn't want in a woman, such as face, upper chest, or abdomen. And some of them present with acne. Some of the girls, they may have cyst, incidentally found on the ultrasound scan of their ovaries. So if we were to meet two out of these criteria, then we would diagnose somebody with polycystic ovarian syndrome. Of course, there are other symptoms as well. So common one is that girls will present with difficulty in losing weight, and some of them will have infertility issues, so they would come and see you for that. So it's, like I said, it's a cluster of symptoms. It's not just one, and intensity of each symptoms may vary in each woman. So they may have different issues, and then they come forward, to see us or endocrinologists. And then you have to put 1 + 1 to make it, 2 together, and then come up with a potential diagnosis.
Okay, so you said that it's usually an endocrinologist that manages this case, because I think a lot of women, they first go to their gynecologist and then they get referred to an endocrinologist.
That is true. Though things are changing, I think, because the girls or the women are becoming more aware. So they've been going through the podcast like yourself, or reading online. Lots of material is nowadays available. But it is sometimes that they've seen a gynecologist for mainly, just suppose, infertility or fertility issues, or sometimes they've noted to have like cysts on the ovaries, so they would then get referred to endocrinologists. So I would say it's just not one specialty management. So it would be the management would be between gynecologists and endocrinologists, which is equally important. Especially the metabolic aspect is dealt best by the endocrinologist.
That's quite a high percentage. Do we know what the cause of PCOS is, or if there are ways to avoid it?
The exact cause is unclear, but there are some assumptions that maybe there may be a genetic element, so that means it may be running in the family. However, you need to have sometimes triggers for it, so either environmental or the diet-related causes. And sometimes they said maybe some environmental issues or maybe stress during the pregnancy of the mother causes changes in the fetus. So exact thing is not known, but maybe you can say the genetic component is the one which plays the role.
Okay, would you say that there are some lifestyle changes that women can follow to avoid getting PCOS?
Yeah, I think the most important thing is to be aware that certain things exist around, which, the awareness, like yourself. And then once you're aware, especially if you think the family member, especially the female in your family, you think maybe you have a PCOS, and if you're at younger age, teenage or something, then be aware that actually you can have a PCOS. Or if you're a mother, as a mother, you have a PCOS, then of course be more aware that your daughters may have it. So it's more of an awareness, and of course then you need to handle it quite earlier. So one of the thing is diet. So you need to have a focus on the healthier diet. Maybe that you would have to avoid high sugar diet and have maybe more in protein intake, maybe more fiber. And then on also the environmental, like avoid the stress, which sometimes it's not possible, but you would want to try as much that not to have that much stress. Just suppose if you get into the age where you're going to have periods, then to have a more aware that the periods are regular or irregular, or there's no periods, then to seek assistance earlier. Main thing is to basically avoid weight gain, because that's the main one that would that can serve as a trigger to have issues with that. So you would want to maintain your weight on the healthy BMI, that is between BMI of between 18 and 25. So you would want to make sure that you also exercising regularly. Make sure that what your calorie intake is balanced, and also if you're having excess calories, then to burn it off. So lifestyle, early consultation with your gynecologist, especially if you're going through the changes like with the periods, early menarche or menarche, and then seeing the patterns, especially if your daughters, to see if the periods are regular or not regular. And then if you suspect later on, like they've got acne, bad acne on the face, or you notice excessive hair growth. So all these things, of course, you need to keep a watch on. And if you suspect they may be having a PCOS, then to have a consultation either by the gynecologist or endocrinologist.
Okay, and once someone is diagnosed with PCOS, what are the treatment options?
So the main, as I mentioned earlier, that the PCOS symptoms can vary a lot. Some of them may have irregular periods or no periods. Others may have issues with the hair growth or the acne. Someone else may come with the weight issues, difficulty in losing weight, and then some fertility issues as well. So the treatment will dependent on what they're presenting with. So you would want to address the concern they're coming to you and see as an endocrinologist mainly. How the main issue in all of them is, which I commonly find, is like if you want to keep the weight down in a healthy range, you can actually address or tackle most of the issues from there. Because they may have insulin resistance, like there's a long-term complications, and that can make it losing the weight difficult. So if I were to address each symptoms, just suppose if somebody is coming with difficulty in losing weight, then of course I would be advising on the diet and lifestyle, and also getting the test done to confirm if they have insulin resistance or not, because if that is there, that's going to make it difficult to lose weight. And what insulin resistance does to make your sugar levels very unstable, and same is the insulin release is very unstable as well. So you would want to avoid the yo-yo pattern with high and lows, and every time it goes low, then you may have sugar cravings, so you may tend to snack more. So you would have advice on the diet, lifestyle, but there are certain medications as well, like insulin sensitizers such as metformin. You want to give that so you can stabilize or reduce the insulin resistance. And then there are other measures which you could help with losing weight, such as GLP-1 agonists, things like Mounjaro, Wegovy is quite common, which that could be needed as well. Sometimes you can just give medications which reduce the fat absorption, like Orlistat. Now, if you were to talk about hair growth, if somebody is coming, of course, you would want to assess their androgen levels, which are male hormones in a female. You would want to assess if they've got a high levels or not. And then if I could offer, or something can be given in terms of the medication, then you would offer that. Sometimes if contraceptive pills are there with a component into it which blocks these high androgen levels. But then again, bottom line for them even is to lose weight. Quite a few of the symptoms you would address as helping with the losing weight. I mean, each, symptoms, if I were to go even in the period, so there are pills there that you could use it. So it's not like a simple straight answer for me to that like we would do for each patient. Each patient's management is different how they're presenting with. Same as with the fertility, losing weight, again, it comes as a main thing, but of course they may need assistance because the issue is normally around ovulation. So they may need medication to assist with the ovulation. So it's best to seek an opinion with the expert, either endocrinologist or a gynecologist.
So there isn't like a one size fits all. It's mostly depending on the case. It changes case by case. So if a woman is diagnosed with PCOS, then she needs to visit an expert and they will do her tests, and then a proper treatment plan will be devised.
And also how they're presenting with as well. One, just suppose not all of the women present with excessive hair growth, right? So they may not need addressing that. They may have some other issue. So it's very individualized. So it's better to seek expert opinion and let the expert address your concern that you're presenting with.
Okay, you mentioned metformin and you mentioned contraceptive pills. And I think that recently on social media, they have been very highly demonized that, if someone has PCOS, then they just automatically go to the contraceptive pills or the metformin. And there are a lot of schools or theories that maybe this is not the best approach. And just because there's a lot of information out there, I want to give like the credible expert opinions on why metformin would be a good solution or contraceptive pills.
Okay, so let's start with the metformin. As I said, it's the medication which helps with reducing the insulin resistance.
Okay.
So, apart from the diet and lifestyle measures, itself, it depends on the high or, how much overweight somebody is or how much excess fat they need to lose. Maybe lifestyle and diet may just be enough for them to actually address the insulin resistance. But in most cases, which I find, they need assistance because they would probably put a lot of effort and then probably not have as much outcome. I've seen the girls, they're quite healthy. They're hitting the gym more than actually I would do or somebody else would do, but the outcome is low. So when you assess that they have insulin resistance, what basically means their sugar levels are very unstable, going up and down, and especially the sugar crashes they get 2 to 5 hours after. It would be difficult to handle without assistance of a medication such as metformin, which helps to improve insulin sensitivity. So your requirement of insulin is less. If you don't address that, eventually PCOS, the long-term complications is for them to become diabetic. So not only that it helps you prevent the complications, but it also helps you lose weight. And not much of a side effects are there. If you read the literature or do the search, then you'll find actually it's kind of a wonder drug. It does help with losing weight, not only just reducing the insulin resistance, but there are also stabilizing the sugar levels. So, the peaks and the lows you get, it helps to stabilize. But there are other positive things, which is, you gained like it's got anti-aging thing. It makes you live longer. It prevents you from certain cancers. It also protects the kidneys and the heart. It improves fertility as well. So even lots of individuals out there and lots of information, especially there are some American professors from Harvard, if you see, lots of literature they're saying, then they even advised even men to take it for, lots of athletes are taking it. So yes, there is a lots of negative things are there, but the medication itself offers lots of benefits. You would also, always want to weigh the benefits against the risk. Personally, I don't think that much of the negative things that it offers, but there are lots of gains you get. And it will help you, stabilizing your sugar levels, help you with the losing weight. Why would one not want to take it? And you're right, actually, lots of the time I do spend in the clinic convincing the girls to actually take it. And once they hear when I explain all these things, 99% I've got, they're not actually hesitation. There's no hesitation from them. They would want to start. And they said nobody actually explained all that. So I think as an expert, it's very important for us to put all these information to the patient and let them decide. And like I said, 99%, I have no problem actually ask them to, convince them to start. Now with the pills, Not all the patients would need the pills. Same as with the metformin, if I find insulin resistance, then I would. Pills is not like it's for everyone, everybody should be on it. But there are certain girls, especially those who don't have a period for a while, like there's no. It's very important for girls to shed the lining of the uterus, otherwise it's going to get thicker, and that makes you prone to have cancers, right? So if you're not having periods, minimum, I would say at least minimum 4, but anything less than 8, I would be thinking probably need to have some sort of a pills to make sure that they shed the lining. So why would somebody would not want to have those pills? So it's just not making the period regular. At times, sometimes that is needed as well, because we do find that those girls who shed their or have regular periods, they lose more weight easily. However, the girls who don't want to have a contraceptive pills, I respect their opinion for whatever reasons, either maybe cultural or the religious or whatever. But then it's equally important that to explain to them that at times it's the need, because otherwise they're going to be prone to have cancer of their womb. And of course, no girls wants to take that risk as well. Yeah. So of course, the media or there's lots of information is there, but it comes to again the same bottom line that you should seek an expert and discuss with them. And I mean, I don't put on all the girls to just be on the pills. There are other measures as well that you could offer. The other medication are there as well if you want to avoid the pills. Again, like I said, the bottom line is maintain the weight. Most of the issues are addressed because of that.
I mean, I completely agree with you. This is why when we decided to do this episode about PCOS, we went to an expert doctor that will be able to give us some credible information, because there really is a lot of information out there that could be false, could be correct, and it's scary that someone on Instagram has a channel that says that they're a PCOS specialist, and okay, I mean, what are your credentials? What makes you a specialist?
You're right, actually. Sometimes what I do is actually I go into this media, like, TikTok, and just to see actually what information my patients are getting. Because nowadays, I mean, they're good too. I would say it's a positive thing as well, because then now the girls are much aware. Okay, they may not have a credential information from these sources, but actually there's awareness. So they do come and question, oh, I just saw this, could it be this and could it be that? What makes me is that, of course, I've got years of experience of it being trained, and also seeing these patients and analyzing. So from myself and the difference and others who sometimes are not very qualified, you need to be very careful who you listen to. Okay, so it's good enough to have information on the media just to be aware of there is something like a PCOS exists. But anything more, I mean, lots of information is there which I've questioned myself why they're saying it. There's nothing, or they would discourage, don't go and follow a doctor give you pills. No, it's not like I said, it's not a simple straightforward management that you would just give metformin to everyone or the pills to everyone, but it may be better case to case. So you would discuss, and I think it's good to question your doctor, whatever they're offering you, why do I need to be on the pills? Can you give me another alternative treatment? I don't want to be on pills, and most of the time we can. So that's what I would say. You don't have to believe what actually on media. So coming back to again, see the expert.
No, thank you so much for saying the part about question your doctor, because I think a lot of people just go to the doctor, and if they hear something that they don't like, then they will just not listen to it, not do what they said, and then just go listen to someone on TikTok or Instagram. But it's really refreshing to hear you say, no, ask all the questions you need, question your doctor, have that discussion with your doctor until you're comfortable with the treatment plan.
Of course, because that's where you're going to get the best information, isn't it? If you're not going to question it, if you're going to go to the media, why would you rely more information coming from the media, not from the doctors? Those patients, and I've got few coming in, they would know that I'm very open-minded. It's more of a rapport between your clinician and yourself. And it should be like, understanding, mutual understanding. Even if you were to agree on the treatment, I would want you to be convinced and agree with me, because I want you to follow my treatment. If I could, it's the same almost pill every clinician would give. What makes a difference is to have this rapport with your if you're a patient with your doctor, and if I'm as a clinician with the patient. So it's a mutual dialogue on both sides. Previously it used to be, I've told you this, go, but I don't think it works anymore. because even the patients are much aware. They come with, I mean, recently, I don't know if that girl is hearing my podcast. She had a full 2 pages question of nearly 20, and I've got limited time. So I just told her, do the rapid fire question because you question and I asked. But you know, I was very proud, and she's only, what, 18? Because she had put an effort and she had all list of questions, which were very important. You know, even if some of them were, she said, I've heard this on the media, but at least she had the courage to clear those. And she said, in the end, she was very convinced to whatever I offered her. It's more of a satisfaction and convincing information that you need to provide for the patients. Like I said, it makes a lot of a difference.
Yeah, that's amazing. I mean, Gen Z, you gotta love them.
Yeah.
They know their questions and they're not afraid to speak.
My God, you know, she's like 18, and I really like the girls when they come with confidence. You know, I never taken as of offense. I'm really, you know, I really appreciate how, because our time, like, we had no clue even what the PCOS is.
Yeah.
These girls, they know what PCOS is, and they would come this and that, and I've read from this. I would rather they ask me and then engage with me, you know, because that makes the difference, isn't it? And eventually they're going to be mothers, so they're going to just make a difference to their own daughters and other family members. So sometimes, somewhere you need to break the cycle, isn't it?
Amazing. Okay, are there supplements or vitamins that you usually recommend to your patients who have PCOS?
There are some vitamins, some of the studies have shown can make a difference, like such as vitamin D. It's quite common because it helps you with reducing the insulin resistance. Also, some studies have showed maybe vitamin K can make a difference. Folate is another one that can help. And some electrolytes, mostly the zinc, you know, not magnesium has normally just been thought of. Do I routinely advise? I mean, we are in a, you know, UAE. I think it's very common.
Everybody takes vitamin D in the UAE.
Before even they come to see me, they're already taking this. Sometimes I need to question, like, why are you taking without having to confirm? So, yes, they do make a difference. Some of the studies, like, but it's not routinely practiced. Like, I won't just ask my patients to, like, look, take the vitamin D, you know, as a separate advice. But yeah, it makes a difference. Inositol is another one which has been taken quite regularly. It got some role in ovulation, not much of an insulin resistance. But I normally don't stop, you know, if mostly they've, like, you know, if they've seen a gynecologist, they would already be on some sort of things. Yeah, so why not? As long as it's not harmful and it's got some benefits, yeah, you know, why not?
Again, it's because of social media. I think also omega-3 is one of the supplements that everybody says you have to take omega-3. You always take omega-3. And I mean, what am I taking omega-3 for? I don't know, but everybody's telling me to take omega-3, so I'm taking it.
As long as it's not harmful, a few things are like, you know, the things like electrolytes, especially magnesium and zinc, one needs to be careful because they all interact and that can affect even calcium and other stuff as well. But as long as it's within the harmless dose, it's fine.
Is there a success rate to how many women are able to get pregnant, even with PCOS?
Difficult to put percentage, but I would say most of them do. You know, but then again, if you see other causes of infertility, that, you know, may have more issues that may cause you to get pregnant as well. So, you know, it's just a fine balance. Yes, PCOS could make you difficulty in get pregnant, but every woman walking through the door with fertility issue, would all of them have a PCOS? No, there could be so many other reasons, you know. So you may think, even you may have a PCOS, but your fertility issue could be because of something else, not as PCOS you're thinking.
Okay, so a bit difficult, but not impossible.
Yeah.
Okay, and my last question. You talked about the complications of PCOS if not treated or managed properly. You mentioned diabetes. Is there other complications that women should watch out for?
Yeah, so when a patient comes to me with the PCOS, and if I think they have a PCOS, I always tell them it doesn't stop there. The management of the PCOS, the symptoms I've mentioned, 4, 5, or 6 I counted, it's beyond that. You need to be aware that now you're at risk of having long-term complications such as diabetes. Also, you may struggle with cholesterol issues. And if you look at the long-term, you know, complications related to both conditions, including heart issues, it could be one of them. So the management, you know, even if you suppose your symptoms of the PCOS is managed well, you need to have a regular follow-up for at least both of these conditions. Same as when you're getting pregnant. It may put you at risk of having the diabetes just during the pregnancy. We call it gestational diabetes. So high blood pressure is another issue because you've got more weight and you've got other two issues going on. So high blood pressure is another one, even during the pregnancy or outside the pregnancy. So it's not one single thing. It's it's the combination of the things, combination of the risk long term you may have with other issues. So just suppose if you're not controlling your diabetes and not controlling your cholesterol and the high blood pressure, of course the chances of having heart issues or the strokes and etc. will be more as compared to the other.
What are some of the myths that you would like to debunk about PCOS?
Yeah, thanks. That's a very important question, and I would want to address. I think this is the best platform to bring it forward.
Yeah.
When we say the term polycystic ovaries, actually it's not the cyst on the ovaries that is an issue. It's more of in the follicles. What cysts are basically is like small ball-like structure with the fluid inside. It's nothing to do with that. So ovarian cysts are very different issue as compared to what we deal with follicles. So that's the first myth. Second one is, if you check the androgen levels or the male hormones, if it's normal, we assume that it's nothing to do with hair growth, or there's no issue with the androgens. At times, it's the skin or the organ is more sensitive to your own normal levels as well. The third one, I would say that all the PCOS girls they have to be overweight. I think I did mention you can have lean PCOS, and that can still make you insulin resistant, and that also can make you at risk of having long-term complications or fertility issues if you were to. So just be aware that having a perfect BMI does not mean that excludes having a PCOS. Then the three criteria at the very start I mentioned that you need to meet 2 out of the 3. And the last one was to having kind of a cyst or the follicles. But you can still have a PCOS if your ultrasound come back as normal and there's no cyst or anything on the scan. So it doesn't mean that, oh, actually there's nothing in there, so I'm fine. You could be ticking the other 2 criteria. Another important one is we assume that it's just a young girls. It's a young girls' issues. Actually, lots of older ladies, they may have issues as well. Sometimes the symptoms get worse around the menopause.
Oh.
Yeah, so these are the few important things I think I would wanted to mention, so just to be aware.
Yeah, that's great, because I didn't know. I actually thought that it's usually women in their 20s and 30s that get PCOS. I didn't know that it could actually get worse with menopause or with age.
Sure, because those girls at some point were younger and they get older. Sometimes the periods and everything do settle, but sometimes there's a flare of around the menopause or perimenopause. So it's worth checking it out. So I would say don't just sit at home and say, well, actually, I'm gone old. It may not be that. Especially struggle with the weight gain, As you grow older, you put on weight. Maybe you have that, and that's why that's an underlying issue, especially with insulin resistance. You should go and actually have it checked.
Okay. Like we said, everybody needs to go to their doctor and just do a checkup, and then we'll see. Hopefully no one needs anything, but just to be safe.
Yeah, definitely.
Okay. From your experience, after a woman is diagnosed with PCOS, how easy or hard is it for her to get pregnant? Because I think this is one of the scariest things for a woman to know, that I'm never going to have a baby, and it's like a death sentence to having kids. So again, let's get the expert opinion on that.
Sure. I mean, PCOS probably may make you, let's suppose, difficult to get pregnant, but it doesn't mean that always you're going to be infertile and that you always need an assistance. At times you may need to see expert to get the medication to get ovulation, but it's not always the case. So I would say, yeah, maybe they may find it difficult initially. It could be just losing weight may help, to get pregnant. So I wouldn't say that, oh, you got a PCOS, yeah, you're going to have a fertility issue. You may have, and if you do have, then there are measures there that we can provide to help you with get pregnant. So that's how I'm going to put it. So it's not like always, and it's not like, death sentence as you put down there. But yeah, if you're struggling, and if you think you have a PCOS, why not? Have it confirmed, have it checked.
Okay, I know I said this is my last question, but just to confirm, you put a lot of focus on the weight part. That is it because of someone, is it because someone is overweight that they get PCOS, or do they have PCOS and that's why they gain weight?
So, at the beginning I said there may be a genetic component into it that may trigger. So this being overweight may be a trigger for your PCOS to get worse. So you would want to maintain the weight, also to keep the insulin resistance down. So remember, it's the combination of many things. Like I said, it's a cluster, it's a syndrome. It's not a disease itself in that, so it's a syndrome.
It's not like a virus and then you get this, it's a cluster.
Yeah, so, and you need to manage or tackle everything simultaneously. I can't just say that I'm going to focus just on the weight for you, But yeah, it makes you prone to gain weight. But there are girls who are actually thin and then still may have the PCOS as well. We call it lean PCOS. So being overweight doesn't necessarily is linked together, But of course, it's one of the factors that can make things worse for you.
Okay, all right. Any advice or any tips you want to give to women who have PCOS, or to women who don't have PCOS but are at a risk?
Just be aware of it, and then that you could be at risk of, certain ethnicity is more prone to, and then you see the family around like overweight, and then maybe diabetes is more prevalent. So just have that in mind that you may have the PCOS, and then focus on the diet and lifestyle, and watch your periods. If they're irregular, have a consultation done, and then remember, when it comes to getting pregnant or conception, then have an appointment or expert opinion prior to even getting pregnant. So avoid the complications, such as gestational diabetes and all that. So I would say be more awareness and more vigilant, and don't be shy. See your expert, have a chat. Even if you don't have a PCOS, your doctor will tell you, I don't think so you have a PCOS. That is even reassuring. It doesn't harm. It takes maybe 15, 20 minutes appointment with the doctor. Take your time out, no matter how busy it is, and have an expert opinion so you are more aware and then can plan ahead, rather than leaving the things late.
Yeah, no, you're right. I completely agree with you. And that patient you mentioned who came with the 2 pages of questions, she's my idol now. Next time I'm going to any doctor, I am preparing a long list of questions, no matter what it is.
And I would be happy to see you if you want me to be your... I'm prepared with the 2 paper questions.
Absolutely. All right. Thank you so much, Dr. Ishrat, for being with us today and for helping us shed light on this very important and understated topic.
Welcome.
This episode was specifically for the ladies. We hope you learned a lot. And as we mentioned, question your doctor. Don't be shy. Say everything on your mind until you're comfortable. We're available on both the YouTubes, Spotify, Apple Podcasts, Anghami, and Amazon Music. Stay well and keep thriving.